A new study is now projecting a rise in cancer cases and deaths among men.
With cancer cases expected to double worldwide in the next 25 years, deaths expected to rise 93% during the same time frame. ABC's Rena Roy breaks it all down for us.
A new study out in the journal Cancer predicting a rise in cancer cases and deaths among men by 2050, with new cases expected to go up from just over 10 million to 19 million worldwide, and global deaths expected to rise 93%.
There are some reasons that scientists look to. Number one, biological reasons. Also, men are more likely to engage in high-risk behaviors, for example, smoking, alcohol, and there's also an occupational exposure. Men are more likely to be factory workers and be exposed to toxins.
Experts say they also may be less likely to access health care, and there are fewer screening options specific for men. The risk is highest for men living in developing countries and of older age.
What we see is that in older men and the aging population, the risk is even higher. We're talking about higher than 100% increase when you look at the year 2050.
Experts say early detection is key. That means getting screened regularly for colorectal cancer at age 45 and consider beginning prostate cancer screening at 50 years old.
I use average patient age or average risk for a patient. If you have a higher risk, for example, if you have a family history, or for black men, you should start having these discussions earlier. It's a sign of strength and intelligence.
Researchers say back in 2020, global cancer rates in men were already 43% higher than in women, the gap only expected to widen in the coming decades. Rena Roy, ABC News, New York.